시청자 여러분 안녕하십니까? KTV 최대환입니다. 지금부터 대한민국
My name is
보건복지부와
Chae-daewan from
질병관리본부가
KTV.
합동으로 마련한
From now on, we'd like to
코로나19
begin
온라인
the
외신 브리핑을
COVID
시작합니다.
online briefing for foreign media jointly organized by MOHW and KCDC. The world is watching Korea for its stable response to COVID-19 situation and to cater to their interests. We decided to hold the online briefing. Today, we're joined by 30 global journalists from 15 countries, including Italy, Japan, and the US through SNS chat rooms real time. Thank you for your attention and interest. Today is the 109th day since Korea had the first COVID-19 confirmed case on January 20th. For the first month, the spread seemed to be mild. But on February 18th, changed everything drastically. On that day, Daegu had the 31st patient, and mass infection began in Shincheonji Church Cluster and the nearby Cheongdo Daenam Hospital, causing a surge in patient count. Daily confirmed cases peaked at 909, with 7,470 isolated patients for treatment. It was a national pandemic emergency indeed. With the virus still spreading all the way into March, the government implemented the intensive social distancing measure. On April 3rd, 75 days after the index case, the accumulated patient counts exceeded 10,000, but finally curbing the surge of the spread. Currently, the daily new confirmed cases are within 10 cases, and patients on isolation for treatment went down to under 1,500. The Korean government is handling COVID-19 stably. Then yesterday, the government shifted the quarantine gear to distancing in daily life. Now, the Korean public and the government are embarking on the new journey, which is a coordination of life as usual and the quarantine. Today, we'd like to share the Korea COVID-19 responses know-how, the lessons learned, and the plan and our vision with the rest of the international community. We will have a 90-minute press briefing, and it will be aired live through YouTube and through SNS. And we provide simultaneous interpretation into English. So I'd like to ask all the viewers from the world to take part. From now on, I'd like to introduce the two special guests. First of all, General Director Youngrae from MOHW and Deputy Director General Jun-wook from Central Disease Control Headquarters. Thank you for coming such a long way. And I can see that you are sweating a little bit because you were running toward the studio to begin the live briefing on time. So here's today's housekeeping announcements. First of all, we collected questions from the foreign press in advance. So I'd like to ask you to answer those questions. I will play the video showing the journalists asking the questions, so you can answer the questions one after another. And then we will collect and entertain the real-time questions from the Telegram chat rooms from all over the world. Before we begin the online briefing, why don't you introduce yourselves? Where do you work for, and what's your role is? After the March 9th first joint government foreign briefing until April 30th, we got a lot of questions from the media throughout the world, and the majority of the questions were directed to MOHW and KCDC. They wanted to know what was the basic system that the Korean government took and what were your roles. Mr. Son, please.
So Korea has an organization that is dedicated to deal with those infectious diseases, and that is KCDC. So Mr. Kwon will be telling you about the organization. And since the outbreak of COVID-19, the government has been providing all possible support, and Ministry of Health and Welfare has been providing financial support as well as providing the structural support. And also, all the central government agencies have gotten together to form a pan-government countermeasure support headquarters. So we have this pan-government organization, and under this organization, we have the local governments that are also working together. So in a nutshell, all these different agencies within the government are working together to combat the crisis. So Mr. Son mentioned about the pan-government infection management measure and structure. And so we have the KCDC in there, and also we have the Central Disaster and Safety Countermeasure Headquarters. And so what does that organization do? So in Korea, we have 4 different levels of crisis alert. And starting from level 1 to 4, KCDC takes responsibility to deal with all this crisis. And the KCDC deals with all these novel infectious diseases and also chronic illnesses and all other kinds of diseases. So we prevent, manage, and control those diseases. And unlike overseas, we also have the laboratories and institutions within the KCDC. So we also play the role of a laboratory. So under the leadership of the Central Disaster and Safety Countermeasure Headquarters, KCDC is dealing with the disease control and prevention matters.
Now the awareness is rising in the sense that we have to approach a new infectious disease like COVID-19 as a security issue. And I think the two, security and the infectious disease, have something in common. Even if there is a small problem, it can affect the all walks of the society. And Korea experienced SARS and MERS a couple of years ago. And before we had the COVID-19 situation, the Korea conducted the drawing board training after establishing the infectious disease task force. How did you do that?
And actually in 2015, when Ebola outbreak took place, and since 2014, U.S. has been leading, or U.S. established an international society called GHS. And ever since then, we have been in the international community acknowledging that health crisis could be a huge security crisis. So the WHO Director General also amended the regulations, and in this way we have made the level of crisis or infectious disease management level much higher. So many different countries have joined in that movement, like Australia and other countries. So we have been conducting tabletop exercises or germ games. So we did these germ games dealing with the avian influenza. And last year in December, since coronaviruses change very frequently and SARS and MERS were also types of coronaviruses, so we had foreseen that a novel kind of coronavirus could take place. So in fact, COVID-19 that took place or broke out last year was one of the coronaviruses. So we conducted the germ game using this disease, and it helped us to conduct exercise to control and prevent the disease.
Korea is well known to rapidly and transparently responding to the infectious disease outbreak to the media and also to the public. How did you think the open and transparent response of the government affects the public participation, being open and transparent in the attitude in responding to the infectious disease? How did you think they work? Well, openness and transparency didn't just come along. During the MERS incidents, we experienced the importance of openness and transparency because we got under criticism, and also hospitals were criticized for not opening the information and for not sharing the information with the public. So after that, the law was enacted to mandate opening up of the information when it comes for level 2 or above infectious disease. So after the law was passed, upon necessity, we make it a rule to immediately sharing the information when it's deemed to be related to the public. And also, COVID-19 was not an exception. Our top priority is that we share information on what's going on with the public. So without having the cure or the treatment or the vaccine, so far we have managed COVID-19 very well. And to do that, I think it was all thanks to the public supports. And they supported us because of the openness and transparency.
So the voluntary participation of the Korean citizen was hailed by the international press, and it was driven by the transparency and the openness of the government. Korea experienced the COVID-19 wave quite earlier than other countries. In the light of such experience, what is the most important element in blocking an infectious disease, Mr. Son? So there could be different factors, and I think we can take 3 lessons. First is that through the epidemiological surveillance, we have to gather information. So when the spread is growing, textbook tells us to actually stop the epidemiological investigation, but focus on the severe patients. But COVID-19 grew with a huge speed, so it was difficult to shift towards focusing on the severe patients only. So we did not stop tracking the patients. So it was very important for us to keep tracking the patients. And the second is very important to carry out the diagnostic tests very actively. Of course, there are some asymptomatic patients, and some patients have longer incubation periods. So it's very important to carry out the diagnostic tests very boldly. For example, there are sanitary facilities, or there are nursing hospitals. In those hospitals, we carried out testing on all patients residing there. And the third lesson is that at the beginning of the outbreak, this COVID-19 was very contagious, and there were a lot of mild cases. So about 90% of those patients did not have to be hospitalized. So it would be very difficult to hospitalize all of them. That would be a waste of some finances, budgets, and we wouldn't have enough beds for all of them. So for the mild cases or for asymptomatic cases, it's very important to build a structure to handle them. So in Korea, there are a lot of hotels or the training facilities. So we utilize those facilities to house those mild cases and manage them. So we efficiently utilize our medical resources. So these 3 lessons are very important for us.
So the medical system of each country should not collapse, and simultaneously we need to rapidly diagnose and treat the patients. If there is a contagion or the outbreak, we can make the best use of the existing facilities, such as the accommodation centers or the training centers. And the next question is that experts predict that the COVID-19 situation will be prolonged, but we need to revive the social and economic activities. And while doing that, how do you plan to prevent the spread of the infectious disease? Yes, I think it's inevitable to come back to the daily activities in the society and the economy. That's why we coined a new concept called distancing in daily life. We are shifting gears to life as usual while having prevailing the distancing. So we are going back to the normal life, but it's a bit different from the life that we had before the COVID-19. We still emphasize on social distancing, but the basic concepts of the social distancing will be coordinated with the daily life, such as when you are waiting in line, you need to have at least 1 meter distance from the person next to you, and then you need to wear face masks. So basically, it's about preventing the spread of COVID-19 virus, so that even if we have a second wave of COVID-19, the speed of the spread will be remarkably slow, and whenever we have a confirmed case, the Center for Disease Control will diagnose and find the patient, and while containing the disease, will be able to lead a daily life as it is. That is what we call distancing in daily life.
So I have some additional questions for you. So there were new terminologies that showed up, such as social distancing or having physical distances, or also the distancing in daily life. Could you give us the definition of those terms? First of all, social distancing is a very functionally, very well-known term. In order to prevent an infectious disease, within a society, sometimes some societies lock down the cities or shut down some of the facilities and also move some of its residents to other places. So there are some very extreme cases of social distancing. But in case of Korea, we did not go to that far. We actually carried out a campaign of social distancing. So we suggested people to voluntarily participate in social distancing, not have social gatherings, and etc. So that's what social distancing means in Korea. And also, social distancing in daily life is quite new to us. It means going back to normal daily routine, going back to work, and enjoying sports, arts, and culture. But at the same time, doing and following all the rules to prevent the spread of COVID-19. So having the coexistence of preventing the disease and actually carrying out the daily routine. In terms of textbook definition, these aren't structured definitions yet. These are the novel new definitions that we came up with.
The Korean government is changing a couple of days ago from social distancing to distancing in daily life. And I think it's worth your attention to have a reference. From now on, we'd like to answer the questions we previously collected from the foreign media. We're joined by foreign press from 15 countries, including Italy and the US, real time through SNS chat rooms. And also we are joined by journalists from Spain, Japan, and the US, and also the India. They gave us the questions in advance. I'd like to begin with the question from Mr. Luca Rossini from RAI, Italy.
Hello, I'm Luca Rossini from RAI, Italy. I have a question regarding the contact tracing system. Can you tell us how does the integration between IT and human resources work? How many tracers has been employed by South Korea from the beginning of the crisis? And what percentage of the total budget of the contact tracing has been spent on human resources? Thank you.
So, thank you. Thank you, Mr. Rossini. So, there are three questions. So, first of all, the question was about Korea's contact tracing system. So, the question was about contact tracing system in Korea. In Korea, in the past. In 2015, we went through MERS crisis, and in addition to gaining transparency and openness, we learned more lessons. So we learned that we also have to utilize not only IT, but also the data that we can gather from people's daily lives, like credit card usage data and the mobile GPS data. And we also provided the legislative background or the foundation for gathering such data. So we can now collect the data from mobile devices of the patients and also gather the credit card usage data in order to trace or track the patients more effectively. And we also open this information to the public in order to trace those who are possibly have contacted the patient. And KCDC in the very beginning had 53 EIS officers. So in each of the cities and provinces, we also have more than 2 EIS officers, and one of them has to be a doctor according to Korean law. And depending on the city, there could be 4 or just 2. So the EIS officers have taken this role of EIS officers, and now in the future we are planning to secure more than 40 EIS officers in the central government alone. And the second question was the number of contact tracers. So most of EIS officers deal with the contact tracing, and in addition to contact tracing, they also conduct this kind of responsibilities. Whenever there are infectious disease patients within a hospital, they have to take care of those hospitals or the patients. So more than 50% of our budget is allocated for contact tracing.
Thank you, Mr. Son. We have Korean viewers also joining the online briefing. Contact tracing is tracing the movements of the confirmed cases or patients under suspicion. Thank you for your thorough explanation. Let me move on to the next question. We have a question from Mr. Pablo Diaz from ABC, Spain's one of the 3 major daily newspapers.
Hello, this is Pablo Diaz from ABC Spanish newspaper corresponding in Asia. Thank you very much for giving me the chance to ask you some questions. First, congratulations to South Korea because it really showed that they can beat the coronavirus in a very efficient way. And that's why we want to know about your experience. So, according to you, what are the main challenges that we are going to face in this new phase, like social gatherings, how to go on with our normal life? And when do you think we can have medicines to deal with the coronavirus before the vaccine? And to finish, do you expect a second wave in autumn or winter, or do you think it's going to be controlled in the rest of the world by then? Thank you very much and good luck. Thank you.
네, 스페인 신문 ABC 신문사.
From Mr. Pablo Diaz from the Spanish newspaper ABC. I think he has asked 3 sub-questions. I think the first question can be answered by Mr. Son. Was a social gatherings or people resuming their daily life? We are at the time point. What will be the challenges we will be facing? Well, as a journalist said, until we have a vaccine or the cure, we can have a reappearance of COVID-19. That's a reality, and I see 2 problems with this. First of all, COVID-19 can cause asymptomatic infection with the fast speed of spreading the virus. So it is very difficult to root out the virus from the community when we have a community infection. And second, because there is COVID-19 somewhere at any time, anywhere in the world, even if Korea no longer has it. So we have a danger of having it from abroad. So our gravest concern is the repetition of the spread of the virus after we go back to the daily life. The second sub-question was about the timing of the development of the coronavirus cure before we have a vaccine. Well, I think we are looking at 4 potential platforms for cures. First of all, a very new drug, a novel drug. Second, we can redirect the existing drug to cure, to treat COVID-19. As mentioned a lot in the media, the U.S. Dr. Anthony Fauci mentioned remdesivir, which was used to treat Ebola virus. And it's now demonstrated that remdesivir was effective in shortening the hospital stay with severe COVID-19 patients. And third was the plasma therapy. We can extract the plasma from the patients who recovered from COVID-19, and that can be developed to have a cure. But developing a vaccine, although we do not have a final clinical outcome regarding remdesivir, we have a significant evidence that shows that it is somewhat effective for severe COVID-19. And also in Korea, there is an active investigation going on developing plasma medication, and hopefully before the end of this year, we will be able to apply the plasma therapy in real life. However, in the case of influenza, we use Tamiflu, but even if we have a treatment, we will not be able to prevent COVID-19 in the first place. So even if we have a treatment, we can mitigate the damage, but we cannot reduce the number of severely infected patients or prevent it. The third question from Mr. Pablo Diaz was, what about the possibility of having the second wave of COVID-19 this autumn or winter? Or by that time, do you think it would be possible in other countries to control virus? Well, as mentioned by Mr. Son, until we have vaccine or treatment, it would not be easy to terminate COVID-19. So I think we need to be ready to have the second wave at any time. So I think we need to think it as a given scenario. It's inevitable. So the key here is how to contain COVID-19, the second round, more efficiently. So the virus will be more active in cold temperature. So the Department of Defense is already warning that there can be an explosive outbreak when the temperature goes down in autumn and the winter. So the Korean government is getting ready for the potential second wave. But the thing is, we aim to contain the disease while having the daily life. So instead of terminating, rooting out the virus itself, it's more about containing the virus.
Next, Donald Kirk of Forbes American Economic Magazine.
Don Kirk, Forbes. I'm just wondering, what lessons do you think the United States might derive from the way Korea has handled COVID-19? And what criticism might you offer of how the U.S. has been dealing with COVID-19? Maybe you can make some comparisons of the problems between dealing with that epidemic or pandemic in a country the size and diversity of the U.S. and a country the size of Korea. Thank you.
So it was a question from Mr. Kirk.
글쎄요, 좀
So I think you have to be a little bit cautious in answering this question. So what are the lessons USA can learn from Korea's way of responding to COVID-19? In addition, how would you criticize America's way of responding to COVID-19? So Mr. Kwon, of course, it's a difficult question to answer because I do not know very clearly the situation in America. But I can tell you the advantages that we have here in Korea, and I could add some more. It's that in Korea, I don't know if our citizens have realized this yet or not, but we have a very good system, good national health insurance system. So all people of Korea can enter any kind of medical facility anytime. So depending on the severity, they can even go to the bigger hospitals of higher level. And this year, during the situation, due to the universality of our national health insurance system, we could test everybody very quickly. And we've learned from the recent mistakes very well. So we've learned from the mistakes from MERS. And in addition to that, in the past, 6 people were hospitalized in one room. So there were 6 beds in one room. But now we have made the distance between the beds wider. So they are spread out within one room. So we have prevented the problems arising in the medical institutions as well. So in the very beginning, we had a huge surge because of the Shincheonji believer, and after that we stopped we have prevented those with the chronic illnesses to going into the social gatherings. We have already experienced that, so we have reflected the lessons we learned from those experiences right away. So we were more active in diagnosing, testing, and also isolating the patients from others. So that's the lessons we learned from our experiences. So then I would like to add to the question of Mr. Kirk. So you mentioned our public national insurance system. So all citizens of Korea, many people are saying that it's a good thing, it's great that we live in Korea where we have this great national public health insurance system. How effective do you think this system was in overcoming the situation? In our National Infection Prevention Authority, we have always emphasized this system. Of course, there could be some disagreements, but in Korea, each and every doctors were dedicated in treating their patients, and they were compensated for that. And all patients did not have to spend their money to get treated, to get the treatment for the COVID-19. So that helped us to identify the patients quickly and treat them easily and quickly. Thank you. So there is one more question from Mr. Kirk. So USA and Korea are different in terms of size, population, and we are different in terms of diversity. Like in the US, there are a lot of nationalities living together. And could there be some kinds of problems arising from that? What do you think? And as you said, not only the US, but all other countries in the world have different characteristics in terms of geography and the population. They all have different social, economic, and cultural characteristics. So experiences of one country cannot be directly applied to another country. But all countries have realized together in this current COVID-19 situation is that such novel infectious diseases, they do not discriminate against nationality. So in any country, in all countries throughout the world, in order to overcome this crisis, it is very important to have a solidarity and cooperation among people. in that sense, Korean citizens were very good at realizing solidarity and cooperation. People have voluntarily refrained from going out of home, and that helped us to bring down the death toll as well. So people did not panic. People did not shop too much. So these kind of things have helped us to overcome the crisis better. And secondly, novel infectious diseases are always something very new and mysterious. It's something that we do not know. We have to acknowledge that we do not know that disease in the beginning. And against that backdrop, we have to make decisions very quickly. And sometimes we can make wrong decisions. In that case, we have to fix them very quickly. We have to make decisions very boldly, but also keep in mind that we may be wrong. And if we do find ourselves wrong, then we have to change our decisions very quickly as well. At the end of January and February in Korea, we thought that there could not be any asymptomatic patients. But we have started to identify the asymptomatic patients, and then we changed our way of diagnosing and testing these patients. So regardless of symptoms, regardless of whether there are symptoms or not, we tested everybody. And there were a lot of asymptomatic patients, so about 90% of the confirmed cases did not have to be hospitalized. So that's why instead of hospitalizing these patients, we decided to house them in the other facilities and treat them there instead of in the hospitals. So that kind of swift decision making and fixing our mistakes, that helped us overcome this situation better. Thank you. Just as Mr. Kirk said, each and every country has different characteristics in terms of population and size and diversity. So it's very important for all countries to share information and keep solidarity and partner with each other. So in that sense, today's briefing, I hope that it will help other countries in combating the COVID-19.
The next question is from Mr. Andrew Simon from Hong Kong's The Asia Times.
Andrew Simon, Asia Times. South Korea has just gone through basically a 5-day holiday. People have traveled all over. If we don't see a second wave after this big holiday period, does that indicate to you that South Korea is out of the woods as regards COVID-19? Thank you.
The question, I think the Korean viewers might be keenly interested in the question. We are just back from a very long golden holidays yesterday, so we are waiting to see the confirmed cases count in 2 weeks from now on. If we do not see increase in the confirmed cases, if we do not have the second wave of an outbreak, can we say that we are out of the woods? Well, unless we have a vaccine or treatment, we cannot avoid the repetition of the outbreak. But in recent days, the daily confirmed cases are well lower than 10 cases, but a majority of them are inbound travelers, and less than so 5% of the confirmed cases are infected from unidentifiable sources. So this means that we recovered the control toward COVID-19. So I think we can maintain this level of containment and control against COVID-19, whereas widening the daily life and increasing the mobility to go back to the life before COVID-19. But at the same time, we need to control the COVID-19. So it's not yet the time to take off the face mask, right? Yes, right. Well, up until now, we have answered the questions that we collected in advance through video. And in addition to them, we collected 41 questions via email from 21 foreign journalists from the 18 media companies in 12 companies, and some of the questions related to the economy, international cooperation, and the expats issues. However, since we're joined by experts from MOHW and KCDC, I don't think these are their expertise, so I'd like to ask for your understanding for skipping those questions.
Yesterday, the Korean government announced a transition from social distancing to distancing in daily life. Here are the questions related to it. So first question is from Mr. Morten Zundengard Larsen of Jyllands-Posten, Denmark. In regards to the loosening of social distancing, what do you base the decision on? What are the risk factors that have gone down? And how important is the economic situation in the decision? How sure are you about the safety of it? And what if the numbers of patients start to increase again? So this was the question. So Mr. Son, I think you can answer this question. Just as you mentioned, as the journalist mentioned, economic matter is very important in making this decision. So a lot of economic activities have gone down. And of course, we did not shut down the whole system like in some countries. So the damages aren't that great compared to some other countries. But some small businesses and the general public is experiencing some difficulties. So we find it difficult to suppressing the citizens keep doing this. So we have set a benchmark that we can control, and we have set a limit under which we believe that we can control the situation. So that's why we can go back to the general, normal daily routine. But at the same time, we will keep monitoring and controlling the system so that the number of patients will not increase again. And if the numbers will surge again, then of course we'll go back to enhanced social distancing campaign. And we will go back to the system that we had in the beginning if we have a surge in patient numbers. So we will repeat these procedures until we develop vaccines and the cures for the COVID-19. Then I want to add one more question to that. So Mr. Larsen mentioned the world economic situation. And do you think stopping or preventing the additional economic damages made you to make this decision? Or do you think, or did you take this controlling economic situation as one of the elements that had to be controlled in transitioning into the distancing in daily life? As you said, it is impossible to terminate or actually remove this COVID-19 totally. So since it is impossible to terminate the situation, we had to set a limit. We have to create a criteria. So within this criteria, we believe that we can manage and control our medical system. So in other words, if we have less than 50 patients per day, and if we have only less than 5% of patients with unknown source of infection, then we decided that we can control the system, the situation. So you said less than 50 patients. So that rate can be managed by the Korean medical system currently. Yes, that's true. So we believe that we have satisfied this criteria for now.
Next question is about our experiences in responding to COVID-19. We have a question from Mr. Patrick Welter from Frankfurter Allgemeine Zeitung, Germany. Based upon your experiences in the past couple of months, what are the lessons that you learned, and what do you think you could have done better, such as expanding hospital capacity, increasing the ICU beds, or having more specialty manpower, or having stronger border control? What do you think it is? Well, instead of preparing for something totally new, I think we can learn from what we have already done. We didn't have enough time to prepare for thorough decision making. We just came up with what what we could do the best within a short period of time. For example, utilizing the IT system to control immigrant procedures for inbound travelers at the airport. We didn't take too much time to come up with that. It was made in such a short period of time. So we just began with what we could. But right now, we are at the process of upgrading the existing system. So even if we are challenged with a second wave of outbreak, I hope that we'll be quick enough but also effective enough to respond to the outbreak because we now have more time. And also, he asked about border control. But as a matter of fact, the Korean government never closed borders. In the beginning, within the country, some people criticized for not closing down the borders. But nevertheless, Korea was quite successful without closing the border. Well, first of all, it was not clear to us about the effectiveness of closing down the border. Well, how many of the inbound travelers are confirmed cases? We did some analysis and we are doing analysis. First of all, there is a risk that the inbound travelers can be source of infection. However, controlling the borders, meaning severing the ties of people and goods that comes through the borders. So we had to do some weighing between the risk of the infection and the risk of closing the borders. So instead of closing down the borders, we decided not to close the border, but at the same time control the infection. So we strengthened the immigration procedures and border control. If we see a patient under suspicion, we strengthened the contact tracing and also the quarantine measures. So in a nutshell, instead of locking down the doors, you decided to keep the door open and you let the people in, but you manage them transparently and effectively. Yes, it is.
Next question is about the human resources mobilized to fight COVID-19. It's a question from Jong-min Kim of Bangkok Information, Thailand. So Korea's drive-through screening stations, diagnostic kits, diagnostic capacities stood out among other countries. But in terms of working conditions of the medical workers, do you see it as being too harsh on them? So it was the question from Mr. Kim. What do you think? Being too harsh? I don't think we've been too harsh on in terms of working conditions. We have very well-trained and qualified medical workers and very high level of the medical institutions in Korea. And during this COVID situation, we have once again realized that the high levels of dedication of these medical workers and everybody, the public and citizens and everybody are thanking the medical workers for their dedication and hard work. So for your information, I think you could add some more comments. And recently, when there was a surge of patients in Daegu, we had to have a lot of medical workers in Daegu region. And did the government order the medical workers to go to Daegu or not? Back then, we had to have a lot of medical workers, nurses, and doctors to work in Daegu area. So we have collected or mobilized the voluntary workers. And actually, more than we needed, volunteered to serve in Daegu area. So we sent the first group of people, and some people had to wait actually to go to Daegu and serve there. So that was the situation in Korea. So let me once again thank the medical workers who voluntarily reached out to Daegu area and all other areas with patients.
The next question is about the COVID-19 confirmed case. The question is from Mr. Haruno Horike from NHK Japan. has there been any reconfirmed case in Korea? And if so, what were the measures that you took? Mr. Kwon, please. Well, the reactivation of the COVID-19 virus, well, regarding that, up until recently, we have identified more than 350 cases so far. But the reactivation or the reconfirmation of COVID-19, well, through those reactivation cases, there has not been contagion or infection yet. And in the Central Clinical Board under KCDC, they had a evidence based upon virus culture, media culture results, and to confirm whether the reactivated virus has a power to infect other people. They did the tests, and out of the 21 cases, they couldn't separate the virus that can reinfect other people after culture testing. So, in a nutshell, through real-time RT-PCR, the tiny parts of a virus got amplified by the testing method. However, the reactivation after recovering from the COVID-19 are not clinically significant. That was the outcome. So there was not a single case reported of getting COVID-19 through reactivated confirmed case. So once again, we believe it is not clinically significant.
Now, let's move on to matters related to the possible second wave of COVID-19 and Korean government's future plans. Andrea Sanchez-Brown of Spain's FSpain News asked, what's the current status of Korea's pool testing plans? When would the first such test start? Are there any plans to increase the scope of this type of testing beyond, for example, long-term care facilities? Mr. Son? And I think Mr. Kwon has something to say about this as well. KCDC, together with the Korean Society for Laboratory Medicine, have worked together, and within 1 month, we actually did develop this pool testing method. We have standardized this method. So it means that we do not test this sample of one patient, but we pull together 10 samples of 10 patients and do the PCR testing. So it's called pool test. And it's not about finding each an individual patient, but so we test a group of people, and if we get a positive result, then we can assume that one of those patients tested has the disease. So it's a method of screening a group of people, and in that sense, it's very effective. So we have standardized this method, and many testing organizations in Korea are now being equipped with the devices and the personnel to conduct such pool tests. So nursing hospitals in Seoul region have already gone through these pool tests, about 4,000 of them, and thankfully they all got negative results. So we identified that there are no patients in nursing hospitals within Seoul. So the government of Republic of Korea will be conducting such tests on the facilities with the people with the high level of possibility of having these diseases. And in addition, military can also use this method. Like if one person enters military with disease, then it could be spread throughout the whole group. So when new officers are drafted, they can go through such pool testing to identify the patients. Mr. Kwon, do you have anything to add? Yes, sure. Mr. Son gave an excellent explanation. So the Korean Society for Laboratory Medicine under KCDC developed together this method. And we did different experiments to find out how many people we can pull together at once, like 5 or 10 or 20 and etc. And we identified that the sensitivity does not go down even if we pull together the samples of 10 people. So that's how we came up with this result.
Next question is from Mr. Guido Santebecchi from Corriere della Sera in Italy. And also the same question was from the Nigerian media leadership newspaper, Mr. Sinello Sikero. We'd like to know what is the Korean government's measure to prevent the outbreak, the second wave of virus through silent spread. What is the measure, the plan? Well, it is a rather passive measure, but when a doctor at local clinic has a patient under suspicion, the doctor should report the patient. For example, the monitoring system for respiratory symptomatic patients, while the monitoring hotline will go live pretty soon, networking 50 local hospitals. And when testing for respiratory viruses, 20 or something respiratory viruses, COVID-19 virus will be one of them in a routine respiratory infection virus. And through other such criteria or measures, we will do our best to identify asymptomatic confirmed case living in the community. It is already May, so we have a plan to activate the measure within a couple of days. And let me put it this way, people, especially parents, might be wondering when they can send their children back to school again. Well, you talked about the measure to prevent the silent outbreak. Well, pretty soon, the Korean students will no longer take classes online. They will physically go to school. But still, parents are wondering what if the school will be the breeding ground for outbreak. Well, when there was a pandemic of influenza and other infectious diseases, in the past, we saw that the contagion was outstanding, especially amongst pediatric patients or the children or little children. But they were quite strong to the outbreak, so they were relatively less affected by the infectious disease, but they will function as carriers. So to prevent that situation, we will have nurses at school monitoring school children. And the government has a plan to reopen the schools pretty soon. But the newly confirmed cases are within the control of the Korean medical resources. And because we will continue having the distancing in daily life policies, we will be able to handle that. And already at some schools, they enacted a distancing in school. And we will not repeat the failures of other countries that failed after reopening schools.
Next question is from Mr. Manish Shukla with Z India. As we know, COVID-19 is a contagious disease and safety is a big concern. The most complicated issue in India, including world, or right now, is when and how the cities would be reopened. So, Mr. Son? This is a very important question. In the modern society, we live in a world where there are no borders. So closing the borders will bring a lot of losses and damages to many members of the society. But to solve this problem, we need more than the decision of one country. We need all different countries to gather their heads together and talk about the conditions to reopening the borders. But we are lacking that for now, so we are quite unfortunate to be lacking that. So if we have an international movement, if the international community comes together to discuss this matter, I believe we can find answers soon. Thank you.
Well, in Korea, we can say that the COVID-19 emergency was subdued to some degree. So from the point of view of Korea, what will the post-COVID-19 look like? And when we have the second wave, if we have the second wave of the epidemic, how can we respond? And to which degree we'll be able to continue the social distancing? I think it was a question related to Mr. Patrick Walter from Germany. Well, in the open society, how much distancing will be possible? It's not a question of can or cannot. I think it's a thing that we must do. It's a must throughout the world. I think the key is about the concept of distancing in daily life. So you live with the virus, but the virus should be controlled within the criteria that the society can control. That is the work Korean government is starting to do. So Korea's experience might be helpful, but I think Korea can also learn from other experiences. So I think we need to share our experiences with others and vice versa. I think we can discuss other countries' examples and experiences. Okay, well, when it comes to productive ideas, I think drive-through screening centers or the residential treatment centers, I think these are the good examples, right? Yes. Let me give you an example of distancing in daily life. We just had a general election to elect National Assemblyman. It was a nationwide election in the middle of COVID-19, but we succeeded. We have a very detailed regulations to contain the virus, the distance between people when queuing, when waiting in the queue to the poll. So the turnout was very high, but we didn't see any infection. I think this can be a great example of Korea's response to COVID-19. Well, let me ask you another question. I think this question, hopefully, can be helpful to the foreign media. The Korean government recently began the social media challenge called the so-called Thanks to. Well, Korea is successfully containing the COVID-19 virus, and I think it's all thanks to the time and efforts and sacrifice, dedication of the medical professionals. To appreciate their efforts, we are waging a public campaign. So we symbolized the sign, we adopted a sign language, which is this, with the thumb on your palm. This means thank you in sign language. So through Instagram or media or SNS, the campaign is about the general public having this sign language to appreciate, to thank the dedication of the medical professionals. Yes, the campaign is going very actively. Even President Moon Jae-in took part.
So there are some more questions that we received in advance. Let me ask you two more. First of all, this question goes to Mr. Son. The effective response to COVID-19 made some privacy restrictions inevitable. And do you think this pandemic will redefine the concept of citizenship or their rights and their obligations? I think we have to think about this altogether. In the Korean society, whenever we have a patient, we trace their roots and we disclose this information to everybody. Of course, we do not disclose who they are, but we tell the public where they have been in order to prevent the damages or the spread of the disease to the secondary or other patients. So, for example, we disclose which bookstore they passed by or which restaurant they visited. And in that process, such bookstores or restaurants can go through difficulties in terms of their sales. And we also are reported about the symptoms of the patients who are isolated, and if they do leave their homes for where they are supposed to be isolated in, then we get the messages about that. And that also raises questions about the privacy infringement. But in order to provide more freedom and the privacy protection to more people, we at the National Assembly have decided that we should be disclosing some information for the good of the whole public. But at the same time, when the situation will be better in the future, we will have to think about to which extent we should keep disclosing such privacy information and how much we should be protecting the privacy of the patients. And I think we have to gather the ideas from the international society as well. So in your answer, you mentioned restaurant. So for your information, in Korea, the authorities disclose the restaurants where the patients visited, not to tell the people to not go to that restaurant, but to alert, to let know those people who were in that restaurant at the same time as the patient, to let them know so that they should go and get tested as well, just in case. So in the very beginning, people had some misunderstanding about that, but later on, people came to understanding that it's a matter for all. And that had also lessened the damages caused to the restaurants as well.
The question is to Mr. Kwon regarding the antibody tests. Where are we and what are the tests or developments that we are looking at, and how far are we in terms of the development of the vaccine and treatment? Well, first of all, regarding antibody tests, I think we need that to confirm the immunity of the community or the group, and we have a detailed plan to utilize that. Centered around the specially managed zones, we have a plan to roll out the antibody tests. We already discussed the scale of the antibody tests and what kind of specimen samples we will use, and about the sample size and the antibody count for different age groups and different regions. We already discussed that. And I think the similar studies going on in other countries, but every year we conduct a national public health checkup, and 70% of the Korean public usually agree to that. So I think we have that much sample size for antibody tests. And the latter part of the question was about vaccine and treatment. Well, we have limited evidence, limited efficacy proven so far in other countries, and we are trying to develop vaccine in Korea. Among Korean companies developing vaccines, I think we will have a concrete picture earlier next year with clinical evidence of efficacy. It is not about evaluating vaccine going through general measures, but because we are at the emergency situation, we are expediting all those processes. Vaccine is for healthy people and treatment is for unhealthy people. So when it comes to stability, vaccine requires a lot higher safety than treatment. So having those in mind, we are trying to develop vaccines and treatment, even as we speak.
So up until now, we've been addressing the questions that we received through emails and through the video files. And due to time constraints, please do understand we could not address all of the questions that we received in advance. So now we have about 20 more minutes, and we will be answering those questions that we are receiving through the SNS chat room. So we will be addressing those questions related to the Ministry of Health and Welfare and KCDC. So behind me, you must see a screen. It's showing my laptop screen, and this is the, you can see even my face, so there are a lot of attendants in this chat room. They are the representatives of international press, and many questions have arrived, and we have selected some of these questions, and we will be answering them now. So this chat room was open in advance, and from 15 countries, about 42 journalists are in this chat room and sending their questions to us. So could you summarize some of those questions for us, the panelists? The first question, Mr. Choi Sang-hoon, representing New York Times, correspondent in Korea. So what are the specific guidelines of the, I believe that other countries are much interested in the specific guidelines of the distancing in daily life, and what kind of a process of debating did this decision-making take place? So let me answer this question. So now since 3 weeks ago, we've been having less than 50 new daily confirmed cases. And in a way, it could be called an exit strategy, or we are trying to reopen the daily routines, allow people to go back to their daily routine, and at the same time, keep the rules of social distancing. So we started to think about the ways of achieving that. So the experts in Korea, like experts from KCDC and our ministry, got together to come up with ideas of how we can sustaining this social distancing movement until this situation is eradicated. So we came up with the 5 key rules, the principal rules for the individuals. And also we have came up with the rules to protect the groups, 5 rules for the groups, regardless of them being private or public. And based on these basic principles, we want people to adhere to these principles in their daily lives, when they're traveling, when they're enjoying the cultural sports event, etc. So we have come up with detailed guidelines. So we have about 31 detailed guidelines of achieving social distancing in daily life. And now we are reviewing 40 more guidelines. And of course, these are new. Some of the guidelines could be very easily applied in daily life. Some of them could be contradictory to some others. So we are still collecting more opinions and ideas of experts. We are working on these guidelines. And this is a road not traveled by anyone yet. So it's something new that we have to create.
또 이 시기가 왔을 때 도움이 될 수 있게 조금 전에 하신 답변
If you
중에서
give advice or small tips to the governments all around the world when you develop the ground rules of distancing in daily life, with which groups did you discuss or get consultation from? Well, we get consultations from the infectious disease specialists and preventive medicine specialists mostly because they are in charge of specialty for infection. But also, we had to think about humanitarian or social factors. So we involved the economists or experts in sociology. Okay, let me move on to the next question from Mr. Pelter-Walter from Germany. When do you think it will be possible or it will be allowed to travel into Korea?
지금 현재도
At the moment,
사실 꼭 필요한 공무와
if you really need to come to Korea for public matters or for economic matters or business, you can get the so-called health checkup results or the COVID-19 test results through consulates or the embassy. Although the number is small, inbound travelers are allowed. But the question, I think it's about the tourism resuming. I think it's more dependent upon the recovery of all other parts of the world. We are looking at the status of other parts of the world based upon continent and the region. Is it more community-based infection or sporadic infection? Or what's the level of the emergency? We are closely monitoring that at KCDC and also at the General Disaster and Safety Countermeasure headquarters. We are getting debriefed on a daily basis. However, at the moment, unfortunately, we cannot say everything is under control. So I think it is premature to predict the general tourism resuming. And some people might be wondering about this. What if the people living abroad for public matters or urgent business matters, they have to visit Korea? Then what procedures do they need to go through? Well, Korea has embassies and consulates in different countries, and there are some paperwork to do. So you should apply for visiting Korea in advance, and through embassies, the Korean Ministry of Foreign Affairs will make a decision. If my recollection is correct, up until now, a couple of hundred cases got approvals for visiting Korea, but a very small portion of those hundreds of cases got confirmed cases. So we are still closely watching the cases, but there is a way to visit Korea. Well, another thing is we are not putting any restrictions or banning on visiting Korea. But even if you're visiting Korea for a short time, since April, we are putting a 14-day mandatory quarantine once you enter the Korea. If you want to come to Korea for business or academic symposiums or short visit, the 14-day quarantine will be very burdensome. But if you have the approval through the local consulate of Korea, you can be exempt from having the 14-day quarantine.
Now let's move on to question number 3. So Mr. Son coughed a little bit, so he covered his mouth with his arm. I think he's very well trained. So from Wilhelmsposten of Denmark, we have a question. It seems like Seoul is going back to daily routine slowly. What kind of differences will be made? What are the effects of distancing in daily life?
그 코로나 이후의 세계가 완전히 달라졌다는 것은
So we all agree that post-COVID-19 world is totally different from what we had in the past. So people are not shaking their hands anymore. Starting from 2013 when we had SARS, people in Korea started to wash their hands much better. And I believe there will be more changes like social distancing will be more frequent in Korea. So people will be keeping their etiquette and having meetings not face-to-face but have more online meetings as well. So just as I mentioned earlier, people of Korea have been very actively participating in such campaigns and movements. We have this Korean spirit that is demonstrated every time we have crises and difficulties. And we also talked about the general elections, and even in those difficulties, people kept those rules, followed the rules that were provided to people very transparently. And if you visit Seoul after this COVID situation, you will be seeing the differences. So, for example, before entering a shop or restaurant, people will be checking your body temperature, or you will have to go through some kind of procedures, etc. So these kinds of differences may take place in the future in Korea. So this term new normal or new norm is mentioned a lot lately. So we are very curious to see the future of post-COVID Korea.
The fourth question is from Mr. Jang Mei-chun from the Singapore Straits Times. Mr. Son said that the second wave of epidemic is inevitable. You just said that. And how well is Korea prepared for the second wave? And after the first wave, after experiencing that, in what ways do you think you can do better?
말씀드린 것처럼 현재도 저희는 한 5% 이내의 환자들은
At the moment, about 5% of the confirmed cases, they are infected from unidentifiable sources. So there is quite a portion of people with the unidentifiable sources. And the 31st patient or the patients got infected in the Shincheonji Church cluster. I think it all ultimately boils down to the first patient. That person became a super spreader, I guess. So likewise, at some point of time, I think second wave of outbreak will be inevitable. However, it will not be like the first wave when we have had an explosive surge because of the Shincheonji Church cluster. We will have a second wave of infection, but it will be contained in much smaller cluster of infection. Because of the social distancing and the distancing in daily life and our infectious disease control efforts, the size of the infectious group and the affected group will be much smaller, and the speed of the infection will be much slower. And we have a strengthened monitoring and surveillance system, and there will be, and there is an ongoing monitoring and screening system. So for example, let's say there are 10 confirmed cases. We have a system to identify at least one of them immediately. So with the one confirmed case centered around the KCDC, we will do contact tracing to identify all the potential people possibly affected by the confirmed case. In that way, we'll be able to block the way of infection, the way of spreading the virus in the first place, and we'll be able to minimize the size of the population affected by the virus spread.
So now we are addressing the questions that we are receiving in real time through SNS chat room. Next question is from Im Myung-soo of Singapore. So we have two questions. First, there have been some mention that COVID-19 can happen more with the temperature going down. So when it's colder, there could be more COVID-19 cases. Is that true? And
이런 질문입니다. 자, 그리고 하나 더 질문해 주셨는데요.
do you think that air conditioners can spread COVID-19 more? And is Korea going to order banning on use of air conditioners to prevent the spread of COVID-19? So first of all, in regards to the temperature, viruses are weak. They become vulnerable to the temperature, but it's more about the density. So it's not about the temperature being high or low. Even the tropical regions have the rainy seasons or dry seasons. And when it becomes more dense, and in Korea as well, during the winter seasons, we have more influenza and flu because people are gathered in the indoor areas, and of course in indoors people will have more dense population within the indoors, and it will be more likely that people will be contaminated or infected. So if we have the second wave, if we do have the second wave, we believe that it can take place not only in winter, but even before winter. And in terms of using air conditioners, if you use air conditioners, the air could be conditioned to 22 to 25 degrees Celsius. And under such temperature conditions, the viruses can survive for up to 5 days, according to some studies from Britain. So we recommend our citizens to ventilate the room as often they can do. And even if in schools they will be using air conditioners, they will have to open the windows, at least 1/3 of the windows, when they have the air conditioners on during the classes. So the lessons learned from other countries and the lessons that we learn from our own mistakes will be applied in a timely manner. Thank you. So in regards to air conditioners, so it's very important to ventilate the rooms when you're using air conditioners. So, and if they're using air conditioners in school, they should open the windows, at least 1/3 of the window, and run the air conditioner. That was the recommendation given by the Korean government. Thank you.
One last question is from Mr. Shah from Anatoly Media Company, Turkey. Well, what tips or advice would you like to give to other countries still struggling with COVID-19? And another question is, do you have a plan to recommend not to use air conditioner in public places? Well, the second question can be skipped. It's already answered. So, what would you like to say to the countries struggling with COVID-19? Well, I think I've already answered the question. So I think Mr. Kwon, in terms of epidemic efforts, I think you can have some advice to share. First of all, minimize the damage or lower the death toll. You need to think about that. We already know certain things, especially senior citizens and the people with the underlying diseases. They are extremely vulnerable to COVID-19. So for them, we need to block the virus in the first place. And you need to have a community quarantine to protect the most vulnerable. You need to, this way, you can identify confirmed case one after another, ultimately controlling the disease. So what worries the government is how to share information as soon as possible and give briefing to the public like we are doing. Korea holds a twice a day daily briefing to the public. I think that will be very helpful to induce the participation from the community and the general public. With that, I think you can overcome the epidemic emergency. We still have lots of questions asked in the chat rooms, but because of the time constraints, I think we need to call it a day. Before we finish, I'd like to give 1 minute to each of you to briefly share with you the future plans of the Korean government regarding COVID-19. Okay. The Korean government is traveling a new road. 이 social distancing is not in the textbook. Lockdown for a couple of months or reducing the mobility of people are in the textbook. But living daily lives with social distancing still going on, this is an unprecedented trial that the Korean government is doing. So we still need to wait and see how successful it will be. But the key is to have the general public's participation. And I think and I hope that we can share the success or the experiences of the measure with the rest of the world.
So my final remarks. The government of Republic of Korea hosts every day the meetings hosted by the prime ministers and the heads of local governments. We have that meeting every day at 8, and we have that meeting for 1 hour. And so in that meeting, we discuss different matters and we make decisions right away. So this system is very effective. We are very efficiently making decisions. And through this COVID-19 situation, Korea's COVID-19 response way has changed a lot of things in Korea, and we are getting ready for those changes, and we want you to know that we are doing those things. So thank you. That was Mr. Youngrae and Mr. Jun-wook. Thank you for joining us today. So for 90 minutes, we have had the online briefing and we'll be answering different questions from the international press. And if we had some questions that were not answered, we will be providing the answers to them in writing. In the backdrop of COVID-19 pandemic, the leader of Korea's infection prevention and control measures, President Moon Jae-in, has repeatedly stressed that solidarity and partnership with neighbors gives the power to overcome the difficulties. I personally, as an MC working for a national broadcasting company, I've learned 2 lessons. First is that taking care of and having solidarity will wins over the hatred, and I learned also that transparency wins over the fake news. Korea supports medical workers and governments of the world, wishes a quick recovery of patients, and sends earnest condolences to the deceased. This concludes the online briefing on COVID-19 for foreign media. Thank you, all the international representatives of the international press, for joining us.